All right, all right. We are on. Welcome everybody to this week's episode of Weekly Dose with Dr. Uday. I am super excited. I have an amazing doctor here with me today, Dr. Mukanga. So we're going to be talking all things teeth, and we're going to be talking about losing teeth and why that can happen and what you can do about it. So I'm going to start with introductions, and then we're just going to get right into it. So for those that don't know me, my name is Dr. Uday. I am a board certified family medicine physician. I am based in Martinsburg, West Virginia. I co-own a primary care practice, namely Apple Valley Family Medicine. I provide aesthetic services as well. And with both modalities, my goal is to have my patients not only feeling good, but looking good. So I'm going to turn it over to Dr. Mukanga to introduce herself, and then we're just going to get right into the questions that we have for today. So
Hi, everyone. Thank you, Dr. Uday, for having me here. So I'm Dr. Valerie Mukanga, and I am a general dentist. I practice here in Arlington, Texas, which is in the Dallas, Texas area. And I did train at the University of Memphis, Lord God, at the University of Tennessee
yes.
in Memphis, Tennessee. And also, after I was done, when I graduated, I went to New York, and at Bronx-Lebanon Hospital, I did a graduate residency program for general dentist. And so here I am the CEO of Healing Wings Dental, which is my own practice. And my goal is to help my patient achieve optimal oral care and aesthetic, but in a friendly environment. I know that a lot of people are very stressed out. A lot of people come and they say, I hate the dentist. That's not uncommon, but we like to gain their confidence and have them, even the most anxious patients, just help them in that way by making them comfortable again. Yeah.
Love it, love it. Thank you so much. Well needed, well needed. So let's get right into it, Dr. Makanga. So the topic today is why am I losing my teeth, doc? So from your opinion, why does that happen?
So there are many causes or reasons why people lose their teeth. One of them is through decay, dental decay of cavities. Another route is because of gum disease. So cavities is almost a no-brainer. You just have a cavity, get so big that unfortunately the tooth can no longer be restored and you have to have the tooth extracted. Another one is gum disease. I've seen a lot of people that come and they say, or even people that I see and I tell them, that they do need to see the dentist, and they say, well, I don't have cavity problem. And it's like, you might be right, and quite a few people actually don't have problem with cavities. However, the state of the gingival tissue or the gum is not good, so they have gum disease, which is either at the level of the gum called gingivitis, or they can also have bone loss, periodontitis. And so a lot of people lose their teeth because of the bone loss. You would have perfect, in quote, perfect teeth, no cavities, but because you've lost so much bone, which is the supporting structure of your teeth, now you're losing teeth. And other people have to lose their teeth because, like wisdom teeth, they might not have been positioned correctly. And so now we have to remove them so that they don't end up damaging the teeth adjacent to them. We've seen cases of people who've had their wisdom teeth positioned in such a way that now it encroached the other tooth, causing decay on that one. And it's in an area where the tooth cannot be fixed because it's more like at the root level. And so now instead of just losing the wisdom teeth, they're also losing the other teeth that they would have been using otherwise. Yeah.
Gosh.
Then you also have babies, in general, babies just lose their teeth because they're going to have teeth coming in, the permanent teeth. So
I,
that's pretty much, yeah,
I
in
got
general. You also, I'll say there's also some diseases that will, cause you to have periodontitis, like, diabetes, diseases like that, where, it just helps losing more bone. And so in that way, you lose teeth as well.
Gotcha. Okay. So from your perspective, how common is this issue?
So it's quite common, according to the CDC. In fact, Dr. Ude, 7% of the population, the American population, have lost at least one tooth by the age of 17. So
Mm,
that's before even going to college. However, as you grow in age, when we're looking at people aged 35 to 44 years old, now it has been increased. The percentage has increased to 69% about. And then going even higher, there's about a quarter of the population aged 65 to 74 that have lost all their teeth.
mm.
So it's fairly common. It's fairly common.
Gotcha. Now, what treatment modalities do you have available to help with, dental loss or teeth loss from, you know, I guess some of the causes that you just mentioned?
So it goes really from prevention to treatment. Yes. So initially, in order for you to not get to that position, you want to make sure that you brush your teeth really well. You brush your teeth at least twice a day, morning and night. Night is so important, doctor, because at night we have less saliva, while the saliva helps in decreasing the ability of the bacteria adhering to teeth, causing cavities. So it's very, very important after you have eaten your last meal for you to brush your teeth. Because some people just do it once a day. You also want to floss your teeth because between the teeth, the bristles of the toothbrush don't reach. And so you want to use dental floss now to be able to remove all the debris and bacteria between the teeth. Besides that, you want to make sure that you do see your dentist on a regular basis, at least twice a year. So every 6 months, you want to go ahead and see your doctor.
Mm,
Mm.
wow, that's really important. So,
That's
yeah,
on the prevention level.
prevention, okay.
Yes. And
Um,
then, go
and then,
ahead.
Benny, what do you do for treatments for people that have lost their teeth?
Right. For people who have already lost their teeth, there's also hope. So you can have dental implants where you replace the tooth that has been missing. Um, Placing an implant, and then you're going to put a crown on top of that. And so the crown is going to have the shape of a tooth, so no one will ever know that you lost a tooth. Another way to do that, to replace the teeth that you have lost, would be dental bridges. And those are where you take some artificial restoration. They look like teeth, but they're connected to the teeth that you have, the adjacent teeth or the teeth next to it. So let's say you lost one or two teeth, they take the teeth that are next to the missing spot and we make something that looks like a bridge. Except for the area that's in the middle, you have one or two teeth or however many teeth that you have lost replaced and they look like teeth. So again, no one would know. You also have dentures. Dentures, those are devices that you remove. You have to remove at night to make sure that your gum is not does not end up being having candiditis or things like that. But like those are also prosthetics that you're going to put. You have some that are partial where you still have teeth, but somebody that has lost all their teeth, then they would have a complete denture. And in addition to that, now there's some complete dentures that can be placed on implants. So now instead of taking them, they actually remain in your mouth and you have to go every so often to get them cleaned, make sure that it's okay. So yeah, those are some. Mhm.
So just to get a synopsis in general, because I know you kind of put some tips in there here and there. So the final question medically is, what in general tips do you have for to help people prevent losing their teeth? And you kind of said some of them, but if you could summarize.
Right. So again, I'll just go over it again. It's pretty much you want to make sure that you do take care of your teeth. You brush your teeth very well. There's one thing that I forgot to mention, doctor. What causes people to lose teeth is also drugs. You
Mm,
know, so something like meth is
mhm,
very dangerous because it's going to just eat up all your teeth.
mhm,
So, what you want to do is make sure that you live a healthy lifestyle, stay away from drugs, make sure that you have a balanced diet as well. Nutrition is very important. You want to make sure that you eat the right food, not food that has too much sugar in it, and also not food that is there's some food that are sticky, say like chips and things like that. They're just going to remain on your teeth and then bacteria can just get underneath, eat up the food, and cause, acid that will destroy your teeth. And brush your teeth very well, floss, see your dentist on a regular basis. And as far as medication, some medication that you have to take, some of them cause dry mouth, and dry mouth can also help, like I was saying, with the saliva. So now you have less saliva. You just want to make sure you talk to your dentist about it, because there's some product that can be given to you to kind of help, with the flow of saliva. So yeah.
That is amazing. Thank you so much for that information. Now I'm going to switch gears, just a few questions about you. So I always ask my doctors that come on, why do you do what you do? So I have that question for you. Why do you do what you do, doc?
Doctor, the reason why I do what I do is because I feel like it is truly my calling. In my family, there was a lot of people that had, dental problems, from bad breath to tooth loss. Even I myself lost a tooth when I was younger, when I was about 15. So I had a bridge, in fact. And so, it's very important for me, because I know that in many cases, when you don't have a tooth, it can cause you to have low self-esteem, for
Mm,
instance, or just the fact that you have cavities or deep caries. You can have pain. Now you cannot go to work, or you cannot, go to school, things like that. But also, it's very important. Teeth are very important also for your aesthetic, just the way you look. Even when people, when they have lost all their teeth, their face seem more like, sunken. And
mm,
so there's so many things, but one of the determining factor as well was that there is a correlation between oral health and your overall health. I had an uncle that he ended up having a stroke because of infection, and when he went to see the doctor, it was late that particular day. He actually passed away, because there's a correlation between your mouth and your heart. Same blood that flows in your teeth, it's the same blood that flow in your gum. It's the same blood that can go to your heart or can go to your brain. And so if you have an infection, you can end up having a heart attack. You can end up having a stroke. So it is very, very important for me. I really want to help, my patient not get to that point, because we don't have to.
absolutely. Well.
Mhm.
Now, the other question, with all the experience you've had, all the life that you've lived so far, if you had a chance to meet your 20-year-old self, what would you
Mhm.
tell them? What would you advise them?
My 20-year-old self, I would tell my 20-year-old self, you know what? Don't waste time. Do what you have to do quicker, because I was one. I graduated, and I said, after I graduated college, I was like, okay, I need to take a break. And the break that I thought was going to be a year ended up being almost 10 years.
Gosh,
And so, because once you start working, it's like, And so I would say, if you have something in mind, just run and do it and be done with it.
I
Yes.
love it. So I always ask that question because there's always somebody out there that could benefit. This is so good. So, guys, we're gonna have more coming from Dr. Mukanga coming forward. We have a few amazing topics that we're gonna talk about, but that would be for future episodes. So, Dr. Mukanga, how can people look you up, connect with you, that kind of stuff?
Yes, so we can definitely be reached by phone at, if someone wants to set up an appointment, they can do it and call Healing Wings Dental at 972-213-0202, or they can also request an appointment on our website, which is healingwingsdental.com. But we can also be found on social media, where we just drop some hits and bits of information that's valuable on social media, Instagram, on Facebook, and also on YouTube. And that would also be Healing Wings Dental. Yes.
Thank you so much. This was so good. So, on the flip side, if you're looking for a primary care doctor, we are more than happy to help you at Apple Valley Family Medicine. Our number is 304-350-1087, and our website is www.applevalleyfamilymed.com. So, you guys, I hope you have a wonderful week. Dr. Makanga, thank you again. We're going to be doing more of this. And
Thank you
you,
so much for having me.
right? So fun. All right. Have a wonderful week, y'all. Bye.
Bye bye.